This is Countryside News Channel, your official online and cable news channel, giving you the latest information from the province of Lanao del Norte. Countryside News Channel.
Good day. Here's the latest information from the office of 1st District Congressman KHALID DIMAPORO. Congressman DIMAPORO, during his latest meeting with officials of the Department of Health and PhilHealth, talks about universal healthcare implementation to selected implementation sites in the country. Congressman DIMAPORO also asked about the requirements on how to qualify UHC province. Here are some clarifications that Congressman DIMAPORO clarified during the said meeting with the DOH and PhilHealth officials.
The chairman now recognizes from the majority, Representative KHALID DIMAPORO.
Now, my next question is in regards to the 33 pilot provinces. Is Lanao del Norte part of the 33 pilot provinces, Mr. Chair?
Mr. Chairman, may I ask Yusek Bayugo to answer the question?
Yusek.
Magandang hapon po, Mr. Chair, Congressman. Sa listahan po ng 33, hindi po kasama ang Lanao del Norte. Yun po, sir.
The good Secretary, please share with the members of Congress which are those 33 provinces that we will be piloting the UHC.
Mr. Secretary.
Bago ko po sabihin, Mr. Chair, hindi po sila pilot. Ang tawag po namin sa kanila ay UHC Implementation Sites. At ang 33 po ay for NCR, dalawang syudad po, Valenzuela and Parañaque. For Region 1, Dagupan City. For Cordillera, it's the city of Baguio and Benguet Province. For Region 2, Isabela, Nueva Vizcaya and Quirino. For Region 3, Bataan and the province of Tarlac. Region 4A, Batangas and Quezon. Region 4B, Oriental Mindoro. For Region 5, Masbate, Sorsogon. Region 6 po, Aklan, Antique, Guimaras, and Iloilo. For Region 7, the province of Cebu. For Region 8, Biliran, Leyte, and Samar. For Region 9, Zamboanga del Norte. For Region 10, Cagayan de Oro, Misamis Oriental. For Region 11, Compostela Valley and Davao del Norte. For Region 12, Sarangani and South Cotabato. And for Region Caraga, Agusan del Sur, Agusan del Norte. And for the BARM, it's the province of Maguindanao po.
Thank you, Mr. Chair. May I ask the good Secretary also, what is the criteria that they used for selecting these pilot or strategic implementing areas for the UHCs?
Ang naging basihan na po, kung sino po yung unang nag-indicate na sila ay committed to implement universal healthcare. Nakalagay po sa Section 41D ng batas that the Department of Health is to support, together with PhilHealth, those local government units who commits to implement the universal healthcare law. So, hindi po kami kailangan mag-approve o hindi na kailangan ng approval ng Department of Health kung isang probinsya ay mag-commit na mag-implement ng universal healthcare law. You can do it on your own. Lalabas na po yung implementing rules and regulation at any time, mapirmahan po ito. Wala na pong approval or signal, yes, from the Department of Health if you wish to implement the law, including the integration. Ang naging basihan lang po ng 33 ay sila po yung naunang nag-indicate na they are committed to implement at naisama po namin sa pagpe-prepare ng budget proposal for 2020. Considering meron pong cut-off ang pagsasubmit ng budget sa DBM para po sa budget hearing natin, yung pong iba medyo later na namin nalaman na they are committing, kaya hindi po namin naisama muna yung kanilang proposal. But isusunod po natin sa next budget cycle, isasama na po namin yung mga kailangang suporta para ma-facilitate yung integration na hinihingi po ng universal healthcare.
Congressman KHALID, may I interject? Maaari po bang mabigyan sa mga, katulad po kasi ng programang ito, hindi aware yung mga kasama ko dito na members ng House of Representatives na nagkaroon pala kayo ng consultation sa local government kung sino ang willing na mag-participate dito. Pero sana po sa lahat ng mga susunod na projects and new systems na gagawin ng DOH, pwede po bang magkaroon ng sulat man lang yung mga kasama namin dito, mga members of the House of Representatives, para alam namin kung ano ang pwedeng paghandaan, ano ang pwedeng maging available, upang hindi kami nagugulat na bakit sila nakalista, bakit kami hindi. Sana po lahat ng members ng House of Representatives sa mga bagong projects ng DOH ay masabihang kaming lahat para lang sa aming kaalaman.
We will
In
do
all
that.
departments.
We will do that, Mr. Chairman. So the field implementation and coordination team is directed to make sure that the consultations will be done with not just the local government units concerned, but also the district representatives.
Congressman Dimaporo.
Mr. Chair, I don't feel like my question has been answered properly. They simply just said that local governments simply need to indicate that they're willing to join the universal healthcare program. What do you mean by indicate? Is that a sangguniang palalawigan resolution? Is that a memorandum of agreement between the DOH and the LGU involved? Can I please ask for clarification, Mr. Chair?
Yusek.
Thank you po. Actually, ang hiningi po namin, so that we really get their commitment at hindi po magbaback out, yun pong initially the letter of intent signed by the governor, and to be followed by a resolution from the Sangguniang Panlalawigan, considering that election is going to come, and we do not like to worry that after the election, a change of administration or then the commitment through the letter of intent will not be honored. So to strengthen this, we requested that possibly a Sangguniang resolution that they are committed to implement universal healthcare be given to us so that we will be more comfortable in including them in the proposal of the budget.
Congressman Dimaporo.
Mr. Chair, it seems that it's just a simple letter of intent and sangguniang palalawigan resolution, which is very simple for most LGUs to do. I'd like to ask the good secretary, of all the 80 provinces, how many have sent to the DOH their letter of intent and sangguniang palalawigan resolution?
Yusek.
Actually, the 33 po, they have all the letter of intent and the Sangguniang. 28 provinces po and 5 cities.
Mr. Chair, I'd like to ask a follow-up question. Has this information been dispersed through the League of Provinces?
Yusek. Or anyone from the DOH family.
Mr. Chairman, I think the Secretary General of the League of Provinces is present. He's a congressman now. Maybe we can ask him if they received.
Okay. Who is that? Congressman Chato. Okay. Congressman Chato, maybe you want to give light on this issue.
Having served as Secretary General of the League of Governors, I could not remember an instance when we were told about piloting system in the PhilHealth. In fact, that was the basis of my question earlier about point of care and point of service. Because when we implement the universal PhilHealth approach, leaving only the option for point of service, and you remove the point of care, considering that universal PhilHealth is not totally being benefited by all, then what is left as options for the local government units that are not part of the pilot areas? If the DOH can assure us and PhilHealth that all the provinces, all the people who should be covered are covered, then point of service will be okay. But if not, then I would suggest that the point of care should be revived together with the point of service so that they can work together in tandem. Local governments are willing to help spend for areas that national government cannot spend. But it will be very, very difficult to understand why others can benefit and why some others cannot. They should be placed in one footing, in one situation.
Thank you, Congressman Chato. Can we have a confirmation from USEC of DOH that there was no proper information dissemination on the part of DOH family going to the local government?
Thank you po, Mr. Chair. As far as the leaks po, I don't remember any forum wherein I presented or I was invited or had the opportunity to talk about this implementation side. So wala pong ganun. But what the process that we did, we met our regional directors and asked for possible provinces that may belong to the first batch. That was our initial concept. And there were parameters that were considered during our discussion. Isa po is the maturity of the service delivery network that the province is now doing. Hindi naman po tayo nagsimula sa scratch. We have the interlocal health zone, and this more or less is a smaller version of the province-wide health system that we would like to see. So mature provinces in terms of interlocal health zones and service delivery network are the best or the ideal initial set that we would like to, as much as possible, identify. And based on one of the criteria, isa po ito sa mga tiningnan ng mga regional directors natin for recommending which among their provinces may be a good model for the initial implementation.
Congressman DIMAPORO.
Mr. Chair, my understanding is, honestly, it seems like this was all based on the discretion of the regional directors of DOH for them to propose to central office who should be the best takers for the first batch of this partial implementation of the universal healthcare law. I'd like to move deeper and ask the good secretary, Mr. Chair, what are the advantages or disadvantages to the provinces if they were part or not part of this UHC pilot program for
Secretary.
We reassure that once all these 33 UHC implementation sites are established, it will not disadvantage those who are not included, because all the services, PhilHealth, all the hospitals will have to provide the services as they are necessary and as the conditions of the patients as they present themselves will have to be responded to. So there will be no discrimination in terms of access by the PhilHealth members and its patients to the different levels of the healthcare delivery infrastructure. However, the objective under the UHC is really to identify exemplars or models of near existing networks of providers from the primary care to the secondary care and ultimately to the tertiary care facilities. So the way the Philippine healthcare delivery infrastructure works is this way, if I will be allowed very quickly, Mr. Chairman. We begin with, for example, the barangay health stations. This is the basic delivery unit that is expected to provide primary care, which means vector control, epidemiologic surveillance, health promotion, and a menu of services that is unique to a health station. It's a 7-level system. The next one would be a bigger facility, which is the RHU, or the City Health Center. The third level will be your community or district hospitals. And after that, you have your provincial levels 1 and 2 hospitals, connecting, linking to the DOH levels 2 and 3 hospitals, some of which will be designated as apex hospitals, and ultimately linked to our heart, lung, kidney, children's, and hopefully the cancer center. So it's a 7 level of the delivery infrastructure, but this is not happening in most provinces. It's a very patchy kind of a delivery infrastructure. Yung mga iba ho, mahina ho yung health station o dilapidated, hindi na asikaso. Yung RHU, kulang naman din po ng mga tao, kulang ng doktor. Marami hong mga pagkukulang. Kaya under this universal healthcare implementation sites, naggawa po ng assessment yung mga regional directors para alamin, more or less in relative terms, sino ba yung mga may kakayahan na magkaroon na ngayon ng network, yung linkage, para magkaroon din po ng tinatawag na mas maayos na atin referral and overlaying of a referral system and navigating system that will begin at the basic delivery unit, which is the health station. So, yun po, ang masasabi ko lang po with our collective reassurance from the DOH, yung pong dati ng serbisyong tinatanggap ng ating po mga kababayan, tuloy-tuloy po yan dahil nga, unang-una, mandato po ng ating PhilHealth na talagang mabigyan sila ng serbisyo na nagbabayad naman po ay ang ating pong gobyerno in terms of the indirect contributing membership through the subsidy from the sin taxes. So, pinagpapatuloy po yung membership na yan. So, we reassure you that your constituents will still be able to access the necessary and appropriate healthcare services.
Congressman Dimaporo, you only have 1 minute left, so maybe you can start winding up. Although this discussion is very interesting, and the chairperson is also very interested about this topic.
Since I have to wind up, Mr. Chair. Well, first and foremost, I'd like to thank the good secretary for his answer and his reassurance that our constituents will not be discriminated. But I personally feel and believe, one, my entire province has been discriminated. Number two, I feel that we have been cheated out of the possibility of joining the first batch of the rolling out of this universal healthcare bill. And I feel that the Department of Health and the regional directors simply chose the easiest LGUs to implement the UHC, when they could have instead looked into areas where we're really having a hard time. Kami naman sa Lanao del Norte, look at our healthcare system. In the coastal area, where the highway is there, walang problema. All of our RHUs are Centro Sigla. We meet your requirements. When I first sat as governor, we only had 3 hospitals. Within 1 year, I opened another 2 to cover the 4 corners of Lanao del Norte. We have 5 provincial hospitals. Fully functional, with doctors, medicines, nurses, and we're also independent of the era. Because we're already getting, thank you to PhilHealth, 250 million worth of income. And yet we were not included. Where is the hard part in implementing local healthcare coverage? Yung sa bukid. The mayors don't want to spend in the interior because they have other concerns. Diyan sa bukid, nandyan yung mga MILF. Diyan sa bukid, mahirap ang dalan. These are places that the DOH does not want to enter. That's how I feel, Mr. Chair, which is unfair for us. When you are... Governor Chato served as a provincial governor. Our spending for the provincial hospitals can basically be broken into human resources, salaries, especially doctors, specialists. They're very expensive. What now? Itong mga rollout na areas, libre na, galing sa DOH, I was not properly answered. Secondly, meds and fluids for your expenses for personal salaries. Sometimes it's equivalent to your meds and fluids depending on the number of constituents entering your provincial hospitals. And now what? Because of the UHC, Cagayan de Oro has free meds and fluids. Kami sa Lanao del Norte, wala. And then Infrastructure. Kulang ng yung mga yung province, we don't need it. Honestly, we don't need it. But the interior, they do. In Lanao del Norte. The interior municipalities need the help. Infrastructure. So that we can have functional rural health units. I'm really disappointed that we have been left out of this first batch. I hope, Mr. Chair, that the good secretary will remember the province of Lanao del Norte when they consider the second batch. And we will prepare a Sangguniang Palaluigan resolution and our letter intent. Thank you, Mr. Chair.
We feel the same way, Congressman DIMAPORO, and also many of us feel the same way about that. And maybe all of us could have an equal footing when it comes to universal health care.
You just watched the latest information from Congress. Representative KHALID DIMAPORO cleared his sentiments about healthcare, particularly the process of the availment of the PhilHealth as a flagship program of the government, giving free medical services to its members. This has been Maria Teresa Resniak. Thank you for watching.